Good morning. I'm Sandy Herz, the Director of Global Partnerships at the Skoll Foundation, and it's my pleasure to introduce you to the Hot Topics session. This year, we always try to do a session that focuses on media and media dynamics. We understand that in the world of social entrepreneurs, it's really important to understand how to amplify your story, and the media is such an important part of how that happens in the world, and yet we don't always understand how the media works. And so my hope today is that I'll be able to facilitate a conversation that you all can be a part of. This is not intended to be a series of presentations. It's intended to be interactive and relaxed and candid. And I have a fantastic panel here that I'm really excited for you all to meet. So welcome. I'll run through just a couple of housekeeping items. You've heard this before this week. Please put your cell phones on stun. Turn off the volume. We do want you to keep them on, though, and tweet, especially all the really good stuff. Get the rest of the forum excited and wishing that they were in here with us. Use the hashtag, Twitter hashtag #SkollWF. And I would encourage you to use the app to continue the conversations that are started here. So that's a way for us to stay in touch with each other and to continue what's started. Questions will be taken throughout the session. So when you have something to say, and I hope you'll have a lot to say and you'll jump in often, ask for a microphone. Stick your hand up, ask for a microphone, because this is being taped, and that way we can make sure that you are heard and the conversation is clear for people who look at this in the future. And as is quite obvious from that, we are being filmed. This is not, however, being live streamed. So you don't have to worry about in the moment having to be concerned. So one of the things that I love about these sessions in particular is that we have so much expertise actually in the audience here with us. There are some sessions where maybe there's a lot of issue expertise or particular domain expertise. In this group, we often have as much expertise in the audience as we have up at the front of the stage. And so I hope that you all will sort of see that and engage in that spirit. And toward that end, I would love to know here how many people are social entrepreneurs, just so we get a sense of who's in the audience. Okay. How many of you are filmmakers? Great. And how about news media? Other news media in the room? Wonderful. Funders? Okay. So we really have here what I think of as sort of a perfect cross-section. And we want to have this candid conversation, and we want to explore how media is handling our issues in a way that, and issues more broadly, in a way that we can understand the relevant themes for us and the goals for storytellers, and make this a unified opportunity. So the way that this session came to be is that I was emailing with some of our media partners, and Madhulika and I got into a fairly brief exchange this fall, but a really interesting one, where she pointed out that the hot topic sort of in the NPR newsroom right now, and she's the executive editor of NPR News, was Ebola and how much coverage of Ebola is enough. And that in the age of social media, when news can spread through a variety of informal forms and not always with tremendous accuracy, that it can be hard to know how far is enough. You can correct what's out there, but misinformation can persist. And so in some ways, when you are attempting to continue to cover things to make the issues clearer, you can also be perpetuating the misinformation at the same time. And that got me thinking about a whole set of topics that could fall into that, and the dynamics of news and what gets covered and what doesn't. And so I'd love to start with Madhulika telling us about the NPR experience with Ebola and how they tackled that challenge.
Good morning, everyone, and Sandy, thanks for including me in this panel. Well, at the time that Sandy and I were emailing, it was when Ebola had arrived in America, which just upped the ante in a way that got, frankly, a little absurd. We have a global health reporter, and we had just expanded our global health and development team last spring, so this is an area that we know pretty well. We have a really excellent science desk that has a lot of expertise, so we had actually been covering Ebola. Our first story was from Guinea, I think, April last year. And we had continuously been covering since July, regularly sending teams in to West Africa. And we felt good about our coverage. We knew it was important. We knew that it had the potential to be a really devastating outbreak, and we wanted to shed some light on it. Interestingly enough, we were ready for this notion that Ebola would arrive in the US. And in fact, our science desk said, it's inevitable, somebody will get on a plane, somebody will be sick. And we wanted to prepare the rest of the newsroom because then it would involve our other reporters, our national desk reporters, our local reporters. And we did, astonishingly, we did a little tabletop exercise just playing out how we would report it and what we would do and what are the breaks we would put in about information that would come out and what we would report and how we would confirm it. And the editor leading the charge, he picked the example of Dallas, that a patient would arrive in Dallas with Ebola and how we would cover it. And how amazingly prescient, because 5 days later, that was where the case was confirmed. And what was really good for us and for our member stations, for those of you who don't know, we're a national news organization and we work with local station partners. We had a real level of expertise, and the first thing we needed to do was tell our reporters, you're not going to get sick, it's not communicable in the way that the flu is or something else. Here are the kinds of verifications we want from various authorities. But it was almost like that was when America discovered Ebola. So we were surrounded by a lot of coverage, some of which was very good, and some of which was, frankly, not very good. And it really became this issue of every sort of thing that we would see or read was like, well, that's not quite right. Should we be out there countering that? But then how much of your show on any given day are you going to do on Ebola? We felt the same in the digital space too. There was a lot of sort of hysteria, and in a lot of our blogs and our coverage online, we wanted to make sure that people understood it's really okay. You're probably going to be more sick from the flu, which nobody was getting shots for. So in fact, at that time, we also started, it's September, October, like, where are the stories that we're doing on the flu? And are people going to go out and get their shots? It's really difficult to calibrate that because there's such a pressure. There is such a pressure to respond. And you have to be really careful about it. But I think we feel really good about how we handled it in the end, but it was not easy.
Yeah. So what were some of the tougher moments sort of in the newsroom? Were there real debates?
I think the toughest thing for us was the decision to cover it and thus the decision to send people. It was all voluntary. It was interesting how germs are really tough to deal with. We have a lot of people who've been to places where there are bullets and bombs and they can get their head around it. But the idea of going to a place where there's sort of this invisible danger was tough for some people. And then when, in the States, when people started hearing more about it, you hear these ridiculous things about, schools sort of 3 districts away worrying about Ebola coming to them. So if we sent a reporter, when he came back, is it going to be tough for his kids to go to school because everyone in school knows, oh, their dad just went to the place where there was Ebola. So it's sort of a long-term, you have to think through all those things. Was there going to be mandatory quarantining? If there was, we'd have to factor for the fact that, okay, we're sending someone for 2 weeks, then they're going to be out of pocket for 3 weeks. That's a huge strain on the newsroom. So I think making sure that everybody who went really wanted to go and making sure that they had the best training possible was really important. So we worked with the CDC on some protocols and we made sure that we never sent anyone alone, and invariably it was always teams of 3 so everyone could keep an eye on each other.
And you shared something yesterday with me that I thought was interesting about the extent of Ebola coverage that NPR has done.
Yeah, we were just doing a sort of reckoning of the Ebola coverage we did in 2014, and we did a lot of stories, and the number of people in NPR News across the country and across the world that touched that story, and all platforms was about 100. I mean, it was really a concerted effort across every level of expertise to make sure that we were serving the audience well.
Great, thank you. So Sara Just is the new executive producer at PBS NewsHour, came from ABC, and so you're now sort of making this transition in the midst of Ebola into public broadcasting from commercial broadcasting. How did that compare?
Well, first of all, good morning, everybody. Thanks, Sandy, for having me. Yeah, I joined the PBS NewsHour in September after 25 years at ABC News, and the differences between commercial television and public broadcasting are many, but and I was still very much getting my head around them when the Ebola story presented itself. And it was, for me, it was a very stark example of a story that, while there was very good work being done, and there is very good work being done, certainly Rich Besser here from ABC did excellent work going to West Africa, and very bold work early on. As a producer, I had often had to fight for stories, sometimes that were upsetting and unsettling, and I didn't have that fight as much anymore. I had the opposite of that, which is how much is too much. We could do a 11-minute segment every night on Ebola, but when were we telling the same story over and over? When were we adding new information? A story that goes on that long, that is moves relatively slowly. There were developments, there were developments, but over time you felt like, well, we kind of had that conversation. What do we do new? Or what angle of the story can we show that's new? And so that challenge was very different. In the commercial world, I often you could do that on big stories go deep on big stories for a time, but eventually the pressure was to move on very quickly. And obviously we have on PBS NewsHour an hour every night on the broadcast with no commercials. It's a lot of television to fill. And so we're looking for new angles all the time, but I think the challenge for us can be not to overdo the story and to find the fresh angles. And I'm happy to say that we're also still able to keep looking for those stories. And so we just did a story a couple nights ago about development of a new Ebola suit. And so being able to come back to stories like that is a luxury that I'm definitely enjoying. But for the audience, I think, in our audience and every audience in the U.S. outlets, the challenge of balancing the coverage where the Ebola crisis was biggest, West Africa, versus when there was this, the initial cases in the U.S. was definitely a struggle, and we looked at that very closely, and maybe made the right decision, maybe didn't make the right decision every night. It was definitely a challenge because there was so much concern. Somebody had the Adam from Upworthy was saying the other night that the tweet about more Americans were married to Kim Kardashian than got the Ebola virus. Certainly caught a lot of our attention in that stage.
And do you find, sort of in the age of constrained budgets for media, to do a story like this sort of brings additional challenges?
Absolutely, it's very expensive. But to go to West Africa and to do those stories, very expensive. And we work a lot with freelancers, and so at the PBS NewsHour. And so one of the challenges is, freelancers often will put themselves in harm's way more willingly than they should. And so it's our job when hiring them, to make sure they're taking all the precautions necessary, and to work with them to make sure that that's going on, and certainly that was an issue in the story and continues to be.
One of the dynamics that I've heard that sort of makes it challenging for social entrepreneurs to get coverage is that they tend to be smaller organizations, less sort of visible to the media, less likely to have sort of the PR person whose job it is to be responsive. And when journalists are far away, they're not embedded, they don't have a chance to sort of discover. How have you handled that challenge?
It's very difficult to go into a country where you don't have sources and relations, and to build those quickly. One of the ways, it has to be through connections to large organizations that drill down and have relationships with smaller organizations, and places like the CDC were really helpful on that, and different parts of the UN. And so, relying on those relationships to say, this is a journalist you can trust, are critical. Those relationships make all the difference.
Thanks. Solomon, welcome to the Skoll World Forum.
Yeah, thanks.
Solomon Mugera is the head of the editor for all of Africa for BBC.
Yeah.
And I think it's wonderful to have your voice in this conversation as someone who is from the Global South and an African, to be able to talk about Ebola in particular, but I think some of the other topics we'll touch on as well.
Yeah.
Can you talk a little bit about the dynamics of BBC's coverage?
Yeah, and maybe just a brief about BBC Africa. We broadcast to Africa in 6 languages, that is English, French, then you've got vernacular languages such as Kiswahili, Somali, Hausa, and then Great Lakes, the 2 small languages of Kenya, Rwanda, Kirundi, they form what we call the Great Lakes. So when it comes to coverage of a region such as West Africa, or the 3 most affected countries, that is Guinea, Sierra Leone, and Liberia, we broadcast to those countries in English and French. For us, this struck home in the sense that listeners in Africa have been listening to the BBC for well over 80 years. So there's that heritage, there's that connection. If you go to a country like Liberia or Sierra Leone, they would tell you anecdotal things such as during the days of civil war, the only time that guns used to go silent was when it was time to listen to the BBC's Focus on Africa program. So for us, we knew there was a responsibility beyond coverage of what Ebola was doing, a very dangerous disease. And that responsibility was split into 2. First, reporting the facts that we knew, and then fulfilling that public service responsibility through what we call public service announcements. And telling people the basics about Ebola. What is Ebola? How do you catch or contract Ebola? Once you are infected, what do you need to do about yourself and about people living with you? If you've got a relative who is unwell and they've been found to have Ebola, how do you manage them? If by bad luck they pass on, how do you deal with that situation? So there was that bit of service that we launched in August last year when we realized how ravaging Ebola had become. The good thing about it for the BBC is that we've got resident freelancers, nationals of those countries. And I'm sure some of you who've been watching BBC World News would have seen a gentleman called Umaru Fofana reporting from Sierra Leone in a very prolific manner. In Liberia, we've got Jonathan Pelaili there. And in Guinea, we had an English speaking reporter, Al-Hassan Silla, and we had French speaker Makeme Bamba reporting for the French service. There was something interesting about the way the international community responded to Ebola in West Africa. And particularly, let me say those 3 countries, because it's very important to get the geography right. When Ebola struck and became an international news agenda, people would group it and say Ebola affects the entire continent. Or even to say West Africa, it was not the entire West Africa. It was those 3 countries that were seriously affected. But when you look at how the international community responded, the interesting thing was that the British were heavily involved in what was going on in Sierra Leone, a former colony. The Americans, Liberia, then the French, Guinea. And this just showed you how it was a very good example of how disjointed the international community was in its approach to such a disease. Because if you don't stop it in one country, there's a likelihood it will spread into another. So maybe when we do stock taking, because I think time is coming very soon, when Ebola cases are going to decimate until maybe 0 level, it may never reach 0 level, it will be time to take stock and say, how did we, number one, as nationals of those 3 countries, as Africa, as international community, respond to this disease? For us journalists, the most difficult thing was how to deploy any additional teams to those countries. Why? One, airlines stopped flying into those countries, airlines with international connections. So you had even a country as far as South Korea saying, because they fly to Kenya, if Kenya Airways continues to fly to Sierra Leone, then they will stop flying into even Nairobi. So you had to make a very judicious consideration whether to deploy or not to deploy. And once you've deployed somebody to any of those 3 countries, there is that mandatory quarantine period of 21 days, as we said. What are they doing to themselves? And if you need to quarantine them within any of those countries before they are flown out, what kind of support are you giving to them? Supposing they even contract other diseases such as, say, malaria. How do you diagnose and treat them? What services are available to help them? That was how tricky it was. But I think now, and I'm sure we are going to discuss this as we go along, I'm sure we will be looking into how in future, if a disease was to strike at the level at which Ebola has, how do we handle it? And most important then, also is how we separate fact from myth, from rumor, and from unnecessary fear-mongering that we saw. Whether it was in Africa itself, where people were told that Ebola was brought by foreigners, and therefore they began to attack foreign and any health worker. Whether it's in a country like Nigeria, which dealt with Ebola in a very decisive and swift way, but we had 2 deaths because people believed to cure Ebola, you need to drink salty water. Whether it's in the United States, where even a member of the House of Representatives felt that children from Latin America should be, there could be a danger that could be coming into the country with Ebola. Whether it's in Italy, where 300 doctors wrote to a health minister to tell them we need to be careful about these migrants coming from Africa. 1 case of Ebola could result in a tragedy. Whether it's in the United Kingdom, where a Sierra Leonean student was denied accommodation because you are from an Ebola-infected country, or a 9-year-old being barred from the school in Greater Manchester just because originally they come from that country. These are the things we'll begin to look into in the future and say, have we learned lessons or not?
And I can imagine as well that it wasn't just a professional situation for a lot of the people at BBC, that they would have had family and that it would have been a personal crisis as well.
Absolutely, because we've got colleagues in London who also come from those countries. My own deputy comes from Sierra Leone. And you would imagine the amount of anxiety she's had to go through because her family is in Sierra Leone, her mother is in Sierra Leone. So every time she's thinking, how is she coping, how is she faring on? Can she go and visit? No, she can't, because those countries have not been declared Ebola-free. When the last case is reported, there'll be that period of nearly 2 months. So you're looking at a very long period before anybody from this country, with the relations in those countries, can travel and to go and see what really happened. And even for us, by the way, journalists, we need now to go back to those countries when the situation has calmed down. First of all, to look at the devastation this disease did, and number 2, tell those stories of heroes, people who have kept those countries going in such tough times, and how those countries are going to begin to recover.
Leif Korlum is here in the audience. I wonder if we can get him a microphone. He and I were chatting about sort of the same issues of sort of how do you balance your personal and professional identity as a journalist when you have family. And Leif's wife is Sierra Leonean, and so I'll invite him to join the conversation now and tell us about that.
Yeah, so for those who, is my mic on, is it working? You can hear me? Okay. Yeah, my wife is of Sierra Leonean descent. She's an anchor on CNN. And one of the, I think, most distressing things for us while telling the story, it was kind of twofold. One, was the fact that her mother was in country, her brother was in country, and we were discussing ways, in our household about how we would be able to get them out if the situation got really bad in Freetown itself. So while we were having those discussions, we were also watching the newscasts on CNN and our local affiliates. It was interesting as well because we also CNN headquarters is in Atlanta, Georgia, which is also the home of the CDC. So we were watching the local news, and it was all about Ebola hitting America's shores and the city shutting down because you had two patients coming into the CDC, for treatment. And one of the things that we were really struck by was, everybody in Atlanta itself was very upset that there was this perception that the risk was being taken to bring Ebola into Atlanta. But the thing that really kind of bothered us was that there is also, hundreds of people losing their lives in West Africa, and it was this idea that, our home is being invaded by this topic, but there's home for everybody, and Aisha's hometown was really Freetown, and nobody really seemed to care about that. And so what was really interesting was, as we were covering these stories, we would do 8 minutes on Ebola in the United States, and then we would do 30 seconds on here's a quick rundown of how many people died in West Africa today, and it would be 134 people in a given day. But we had talked about 3 people who were infected but were receiving treatment, and everything was going to be okay for them. So, and we were spending a majority of our time on that. So that was really distressing for us as we were trying to figure out how we could cover this story. And that, I don't do medical stories. I focus mostly on human trafficking. But it was interesting because Aisha started almost, I probably shouldn't say this while it's being recorded, but she started rebelling on camera with her reporting and just saying, like, look, this is inappropriate that we're devoting this much time to a situation in developed countries when the real story is in West Africa and these 3 distressed countries. So I think
We do have a clip of Aisha if you want to show it.
Oh, well, there you go. Perfect lead-in. Yeah. So you can see what I'm talking about as opposed to trying to describe it.
Do you get a sense that a lot of the feeling amongst Africans and African leaders is that the West has not reacted quickly enough because it's not been a Western issue at the moment?
Listen, let me just be very blunt and very transparent for our viewers. My family is in Sierra Leone. My mother is in Freetown. My brother is in Freetown. I have family scattered throughout the country. This is very real. So I am speaking to people on the ground in Sierra Leone, and I'm getting the distinct, not just impression, I am being told that they feel abandoned, quite simply. They feel that the West dropped the ball, the West failed to respond back in March to basically put together an adequate plan that, basically had in it the potential for this to grow larger. So I think there is also this sense, and having interviewed a number of people on this issue, that it is because, as you say, it is in Africa, that there is that sense that, well, it's far away, it's over there, we don't need to worry about it, it's not our problem. But the reality is, if those CDC projections come to pass, that worst case scenario, as high as 1.4 million people in January of 2015. It is all of our problems. It isn't just something contained out there. It affects all of us, if not in terms of cases crossing borders and making it to the West, making it to the United States, then these countries are right now at risk of political instability. They're at risk in terms of the economies falling to shreds, and the West will have to respond. It will have to help in some way, shape or form. And so really, it concerns us all.
So that's my wife. But what was interesting about the response from CNN's point of view is that became the T1 story on CNN.com. But it was CNN reporter gets emotional about Ebola coverage, and so she was So then we had a whole nother discussion after that. But it did. I think reframe for a lot of people in the newsroom just that fact that, while we may not be seeing it to a large degree in America, or if there is the threat of it coming to America, while that is important and it's relevant and it's worth covering, we do have to remember that the story lives in West Africa, and people live in West Africa, and that's what I think people inside CNN became a lot more sensitive to that fact, and I think she was effective in the fact that eventually we did start covering it in a more appropriate manner. But of course, we also did like the idea, this story pitch became, are Ebola fears overblown? Are we covering it too much? And it's like, well, you're still covering it too much if that's not. But it's trying to continue the life cycle of the story, as Sara mentioned, when there is not a lot to say that's new. So I think that was also part of the problem.
Thanks. And I want to jump quickly to John Marks, and then I'll bring it back and give Ray a chance to jump in. But I know John had something to say as well.
No, I'm John Marks with Search for Common Ground, and we have radio studios in Liberia, Guinea, and Sierra Leone, and we took on a public information function. The governments in all three countries asked us to communicate internally, complementing what you were doing externally. And we had 3 journalists from Guinea who were hacked to death when they went out to the one of the villages. There was a group that came from the national capital, and there was a thought that they somehow were bringing Ebola with them. And 3 young program assistants died in that. So I just would like to throw that into this mix. I mean, it was a very dangerous thing for journalists to cover, and we felt absolutely awful. It never happened before.
Yeah, wow. So I think what we can draw from this is these hot topics are not just sort of newsroom decisions. They're incredibly personal and need to be, given the nature of it, because journalists are putting their lives on the line, and it goes far beyond just an intellectual decision. I want to get to Ray without any further ado. Our good friend Ray Suarez, who has been here at the forum many times before, is now with Al Jazeera America, where he is the host of Inside Story. So he is in the unique position now of being part of the Al Jazeera network, which is unique in the media landscape for the level of funding that they have, for their global reach, and in some ways the credibility that they carry in all parts of the world that is different from other news outlets. Can you give us your perspective on Ebola?
Well, from day one, it was never a question of whether, it was simply a question of what and how. But since this is, we live in a competitive environment, we want to talk to audiences in a way that will both get them to stay with us when we're talking to them and get them to come back when they go away. No broadcast ever in the United States during this whole period began at the top by saying, "Good evening. People you don't know are dying in large numbers in a place you couldn't find on a map of a disease you've never heard of and aren't going to get." All of which was true, but we would never say that. So the question was, how do we tell a story that we think is important inside the newsroom in a way that conveys to an audience that we want to keep in the room what exactly is important about this? We knew from very early on that this was not going to be a big crisis in the United States unless we talked about it as if it was one. And when it was politicized, weeks into the story, Republican office holders in the Capitol were talking about President Obama's Ebola crisis, which I thought was pretty amazing and breathtaking. The number of Kardashian husbands is likely to continue to rise, while the Ebola death toll is not likely to continue to rise in the United States. So one number is kind of static, while the other one is fluid and likely to move. We use this as an opportunity both to show off our global leg, lift a little bit, and we have people in West Africa all the time, And so we had live reports from Freetown, from Monrovia, from other African capitals in the region that were taking their own measures and also having their own anxieties about what to do. But when I say we didn't want to waste this, if I went into an editorial meeting one morning when there wasn't an Ebola epidemic and said, hey, let's do a program on rebuilding post-conflict economies, nobody was going to throw confetti and carry me around on their shoulders. But because of the peculiar situations in Liberia and Sierra Leone that actually made the Ebola epidemic worse, these were peculiar circumstances that audiences in America don't hear about normally. And it was wonderful to have an opportunity to remind people of the things that you don't think about that happen in a civil war. The reach of the central government becomes frayed. The institutional structures of public health, sanitation, contagion monitoring, extension workers, all that stuff gets busted and broken and thrown away. And the people who do that, the brave people who do that work, often end up back in the capital for safety. It was a way of talking about other things. And when it became apparent that the world's response had been really slow off the dime, totally inadequate, to the point where the head of the WHO was admitting as much in world councils. We missed it, we dropped the ball, we didn't respond quickly enough and comprehensively enough. We were able to continue to do the story. Yes, obviously, when a new case would be diagnosed at Emory or in Dallas, or Chris Christie telling the woman who had come back, the nurse who had come back from Sierra Leone, that she was going to have to stay in a plastic tent for a month, and she said, get lost, I'm going home to Maine. These provided us the opportunities to do that story that day, tell that story, and then go back to West Africa, where there were really important things to talk about. You know, again, going back to those morning meetings, if I said, hey, you know, it's been 6 years since H1N1, is the world, or 10 years since SARS, is the world any more prepared than it was then, which was not at all, to figure out how to respond in a smart, surgical way to people who just get on planes and go from a place where there's a disease to a place where there's not one. When you had SARS cases in 36 hours in Toronto and Vancouver, when you had H1N1 cases because it came spreading out of a honeymoon area, there were H1N1 cases in Melbourne, London, and Montreal almost immediately. Honeymooners, as they're wont to do, you know, trade germs and go home. And you would never find the occasion to talk about the world's very inadequate toolkit for responding to that new world of disease mobility. But Ebola gave you the chance, and I don't want to sound callous, obviously there was at the core of this a terrible human tragedy, but it gave you the opportunity to unpack for an American audience all the other aspects of this that the news rarely gives you the opportunity to talk about. So it was, on one level, a terrible tragedy, but also a way to remind people why stuff like this is important.
So, you know this audience. Oh, here, let's jump to a question. If I could get a microphone right over here.
I wanted to ask you about the relationship you think that fear has in the media between that line of informing and shaping. And, you know, Arianna Huffington's talked a lot recently about moving away from fear in the media to a more solutions and optimistic way of telling the news. But it strikes me from everything you've been saying that there's a legitimate role for fear in bringing it home to people so that they really care and they can relate to it. But when does that, what is the right side of fear and what is the wrong side of fear? And do you think that it's changing in news media? Are there sort of new shoots of more optimistic storytelling?
Well, the cheap way of handling it is to tease into a break and say, when we come back, we'll tell you whether you're in danger or are you in danger when we know you're not. When we know you're not. And instead of building in prudence and allowing people to put on the armor of knowledge, and I believe that knowledge is a kind of prophylaxis, that we engage people through fear. It's certainly a tactic that's widely used. And it's a much more subtle approach, I think, to use being smart is being safer than is safer than being stupid. I hope they put that on my tombstone. Being smart is safer than being stupid. And what we are here to do is help you get through this in a way that leaves you both feeling more confident and secure and prudently aware of what's going on in a place in the world which right now isn't threatening you, but there are more of these coming down the pike, and in the future they might.
I think maybe to just briefly add to what Ray has said, the bad type of fear is that of misinformation. Mm-hmm. Fear will always be there, but it all depends on what action it triggers. The fear that makes you to run away and the fear that makes you to run towards. You're running towards something to help to rescue. That's the kind of fear we would say is positive fear. But the fear that is bad is that makes you want to run away and away and away. You don't want to have anything to do with that problem. The other thing is the different types of audience you've got to deal with. So for example, if you are not based in Africa or serving the African audience, your audience are the people who are thousands of miles away from Africa, in the United States, in the United Kingdom, and other parts of Europe. How do you deal with that audience? What kind of information do you give them? And on the flip side, if you're serving an audience in Africa, in those 3 countries, what kind of information are you giving them? So it's how you begin to leverage those 2 types of audiences. And then also in the countries that are developed, there are people who want to go and help. Those volunteers that we saw who want to go and help. What kind of information are you giving them to instill in them that optimism that they can look for to go and help?
Anjali.
My name is Angeline Iyer, and I'm a filmmaker that's making a film in Liberia at the moment. And one of our team actually had the misfortune of contracting Ebola, an American who was working in Liberia and who had been working in the sector in kind of development for about 2 years and was doing some video work for us and for other media organizations at the time. And I think it was a terrible thing that he contracted Ebola, and it was devastating to all of us, obviously. But he was fortunate enough to end up in America getting really great care, and he took that as an opportunity, and I think that's what he really sees it as, an opportunity to kind of refocus the light, because everyone wanted to talk to him, and he had this story to tell about all the people that weren't getting the care that he was. So I think that there is, in every single kind of fear-mongering exercise that is taking place, there is an opportunity to refocus and realign and figure out what really matters.
Right. David, I'd love to jump over to you. I mean, you've really looked at the data of how audiences respond to fear-based stories versus solution-based stories. If you could talk a little bit about that.
Yeah, it's very interesting. We're actually working, David Bornstein from the Solutions Journalism Network, and we did a workshop this week with the Huffington Post. We're working closely with Ariana's team. The issue with fear is a really big one. I mean, there's this concept in psychology called availability. They actually call it the availability heuristic. And the basic thing is that people are really bad in math. You assign probabilities based on how readily examples come to mind, not really statistically how probable they are. And so, if you think about the self-fulfilling prophecy of the coverage of Ebola, it is very likely going to reduce direct investment and travel to all of Africa because of the fact that people have these images. The same thing has happened with Haiti. There's so little coverage of the rebuilding after the earthquake, and the coverage of the cholera is the thing that sticks in people's mind, and it has reduced philanthropy and investment in Haiti. The big story in the United States over the last probably 30 years has been the dramatic change in childhood, because everybody's scared that their kid would be abducted by a stranger if they, go in the playground by themselves for 2 minutes. And in fact, that's always been an extremely, extremely rare event. It's not really increased. It's probably more dangerous today only because your child will be the only one in the playground because of the self-fulfilling. So in some ways, and now if just the fact of reporting on that, and then you say, oh, by the way, this is according to the NISMAT database, which tracks child abductions, this is rarer than being struck by lightning, that just kind of goes out of mind. The image that you have of Adam Walsh 20 years ago or whatever the story was, well, it doesn't go away. You can't unlearn that. It's like the jury will not disregard that testimony. And so the question for media when you're giving people these really powerful images is, how do you counter that with, the one sort of image that I found missing in the Ebola coverage, in the Haiti earthquake coverage, in all of these stories is kind of the story of really competent, smart people solving problems on the ground. And what does that look like? And just having a really powerful image of that in some way, maybe that could help undermine the fear image somewhat. I suspect it won't. It's not nearly as available or as vivid. And is emotionally scary, which is really how we do remember things in our primal, primitive brain very. So I guess the question for how we cover these things is, how do you actually deal with the fact that just the presence of an image will sometimes cause people's worldview or world map to shift in a long-term and probably permanent way?
Well, my Haiti rebuilding stories are still online on Sara's website, so I recommend them to you for that story that you didn't see about what really smart people are doing.
I will look at that.
Good.
Madhulika, did you have any thoughts on that?
I think you have to provide enough information for people to weigh up. If you just focus on the one bad photo and counter it with nothing else, then that is the only thing people are going to remember. You talked about people are bad at math and statistics. One of our most popular stories on Ebola, millions of people read that story, and we did a radio version of it. The headline was, "No, seriously, how contagious is Ebola?" And it had a very simple graphic of, your chances of catching it if the person next to you, a variety of diseases from, Ebola to measles to SARS to influenza. And it just knocked down all those myths. It's like, you're really not going to get Ebola because somebody flew into your city and had Ebola. And I think it was heartening to us that people really responded to those kinds of stories. It was like, you talked about fear. We talked a lot in the newsroom about, okay, shouldn't people be scared that 37,000 people in America will die of the flu? We are never scared of that. Every single year, 37,000 people or so will die of the flu. I don't think we can make that scary.
More than in traffic accidents.
Yeah, I just don't think we can make that scary because people are just conditioned, and people are conditioned to think, a scary disease that I don't understand has come from Africa. And what can we do to counter that? I think tell human stories. Whether it's a story about, we did a very tough story, but I thought was really important to do, on the body collectors. And we did a radio version, and we did video as well. And it's something you don't think about. We talked about cultural changes in these countries. You're a mother and your child has Ebola and you are told not to hug them or touch them. How people's connections really change. Nobody shook hands, you maybe touched elbows if you did that at all, or you stood 6 feet away. And I think people can get that in a way that, are they going to care about every single thing we do from those places? No, but I think it's got to be a step away from the, sort of global health industrial complex kind of view of looking at things, and getting on the ground. We did a story in Lofa County, which we did, I think, beginning of January this year, about this area that was devastated. And how do you rebuild that? One wife who did not die, but the other wives in her family did. She suddenly had to start looking after all those children. Nobody had gone to school. Schools were closed. All those things are things that we hope we can go back. It's not cheap to go back and do those stories, but to keep our eye on them.
It also depends on how we are resourced as media organizations and our presence on the ground in some of these places. So, for example, we've got, the BBC has got this international charity called Media Action, who are based in Sierra Leone. They've been there for quite a number of years, helping to build capacity amongst broadcasters in that country. And when you've got that kind of presence on the ground, then it's easier to rely on them to supply information. But it is who are you deploying to tell that story? In most media organizations, we cannot afford to deploy everywhere. And there's an emerging trend which is quite fascinating. And if you're from any NGO here, any international humanitarian agency, whether it's Oxfam, Save the Children, any of these organizations, you will discover that they've mastered the art of news gathering. They've got units that are well-resourced, that they can go anywhere and gather information and supply to us media organizations. So where we cannot go, you find maybe Oxfam is giving you material. Save the Children is giving you material for you to air. And because you can't reach them, because maybe it's professionally done, you look at it and say, okay, fine, we will attribute it to them and then carry it. But remember also, these international agencies, they've got their own agenda. Because when they do that also, they want to appeal for a certain form of response, particularly from donors. So we find ourselves in a very delicate balancing act, how we can deploy to some of these areas and tell a story in its totality. Then the Americans taught us this phrase, shock and awe. So you want this figure that or this image, when you splash it on the screens, people will sit up and say, oh my goodness, the whole of Africa is dying. Let us do something, But then we fail to go back and get those stories of those heroes who, as I said, have kept society going. One last example is, this example was given by the Swedish statistician called Professor Hans Rosling. He went to Sierra Leone, and he gives this picture of a nurse who had 2 mobile phones. On one hand, she was being told about her relative who had just passed on. On the other, she was negotiating for help from a donor. And she was to make a choice which of those 2 telephone calls she was going to attend to. And I would leave it to imagination which one she chose.
If we could get a microphone to Fred St. Lazarus.
Just want to, based on an anecdote, in terms of, I have a brother who is a probabilist, and he used to be dead scared of flying. And I remember once telling him, this was a few years ago, I said, your chances of dying in a plane crash are much smaller than your chances of dying in a car crash. And he said to me, but I can't die in a car crash when I'm in the plane. And I just wonder whether the way we internalize our fears is something that we don't control. And the question for especially people who make decisions on the mix within programs is whether just by virtue of the fact that you're covering this, you're feeding a fear, even if all of your stories are saying you need not fear. Just the volume of coverage itself feeds the fear, regardless of the actual content of the coverage.
Well, Fred, there's even something more corrosive and frightening embedded in your question, which is that a higher and higher percentage of the audience, the total audience, a larger and larger fraction of that audience, doesn't believe us, just doesn't believe us, believes that we are the products of other forces and other influences that we don't tell them about, so that what we spend our working lives trying to do, which is tell the capital T truth and leave you with a better understanding of anything than what you had when you tuned in, they think we're lying to them. Or we tell a shaped, corners cut kind of truth to serve other masters besides them and their needs. And that part, and I see that as I talk to people outside newsrooms a lot now, I hear that kind of thing in a way that I never did when I was producing newscasts at ABC 30 years ago, where we had ideas about what you lead with and why you lead with it and what's news and what's not news. And we were deciding what that was, and we believed that the public believed us. I think a frightening size fraction of the public simply no longer trusts us.
I just wanted to circle back to the conversation about resources too, because as we talk about the stories to cover and make those decisions that Fred mentioned, a big part of that is resources to tell the story, and I thought that was particularly in stark relief recently with the Kenya attacks. That it was a very hard story to cover. There was not a lot of video. There was compared, for instance, to the Charlie Hebdo story, which got a lot of attention and deserved to get a lot of attention, I think. That those choices, being driven by resources, where we have reporters, where we can afford to send reporters, how quickly we can get that information out, is driving a lot of decisions as well, and that increasingly becomes concerning, I think, in a world where media organizations are facing such financial pressures.
And compounding that is the safety issue. I mean, Boko Haram is a really hard story to cover, and it's really not that safe. We haven't had anyone from NPR in Syria for several years because there's a point at which you reach a calculation to say, okay, we're not going to do that. And I wish we had infinite resources so we could be everywhere, but we can't. And you have to make those calculations every day. And I think that people think we have more nefarious sort of notions about making those decisions, but sometimes it's just as simple as that.
And maybe at this point we can give a microphone to Bassem Youssef, who is here originally from Egypt, where he covered from inside the country, but then now from Harvard, where he's teaching. But it would be interesting to get your perspective on coverage of Syria and ISIS and what's happening in the Middle East.
In my country or in world news?
In world news.
ISIS? It's nice to have something to be afraid of. It's just like the news cycle always needs something for. I'm not saying that it's something simple not to be afraid of, but the thing is, as someone who comes from the region, people concentrate on the horrendous stuff that they do, but nobody actually tracks the reason behind it, which basically it's money and politics. It's very easy to be sensational and to say, look at the scripture, look, it's a religion of violence. I mean, all scripture has like very violent parts in it. But the problem is nobody actually goes behind the reason for the influx of money from Gulf countries who are actually allies to the United States, and they fund the most fundamental ideologies in the mosques in Europe and in America, and nobody talks about that. I mean, as a matter of fact, how is ISIS different from some of the monarchies in the region that actually do the same exact horrendous stuff but under the umbrella of the law? But because of the hypocrisy and because people are addicted to oil, nobody speaks about that. But it's much easier to talk about the horrible men in black and with beards who behead people. Other people do that and they don't wear black. Actually, they do that with a police officer standing next to them. I don't know. I find this very interesting, for a very polite way to put it. Yeah, that's my view. I mean, it's easier to go after a religion or people who follow that religion. And there are people who are called Muhammad, Ali, Ismail, and Mustafa who don't even pray or fast Ramadan, but at the end of the day, they're put in the bracket of being in this fund. They're just being profiled. It's very easy to create an enemy and to galvanize people against this enemy and be sensational. But I think that's not the real enemy. The real enemy are regimes that are actually in bed with the Western countries.
So would anybody on the panel like to respond in terms of your coverage of those issues?
No, but I'm sorry, I mean, these are like fine people, like the list is amazing.
Yeah, absolutely.
I'm talking about Fox News, like, I mean, which by the way, I mean, let's be pragmatic. I mean, do you blame them? I mean, they need ratings. I mean, so I mean, it's very. I mean, one of my very good friends, he's a stand-up comedian, Mas Jurani, he said, like, I mean, there's nothing funny about bringing an Arab and make them baking cookies. I mean, there's nothing interesting about it. Hey, here's Muhammad baking cookies. Yeah, I mean, doesn't get rating. However, you can get Muhammad baking cookies followed by news about some bomb, etc. What was in these cookies, you know? So, oh, Muhammad, come on. So anyway, so that's me.
It's just in the sort of the media. I was meeting with someone this morning from a drug company who worked on social responsibility, and I was saying I was going to a panel. I said I often find myself in a media panel where I have to answer for all the sins of all the media across the globe. And he said, well, drug companies, you know, if you work for a drug company, you often have to do that too. I mean, I think that we live in, the thing that is both exciting and depressing for me as a journalist is, what's exciting is we have access to so much more information than we ever had before. But what it means is that people gravitate to the things that they believed already. So we have so much information, but a large portion of the public are still not informed. And that's kind of depressing. And I think our charge should be to figure out how do we redress that balance somewhat.
And maybe I could just throw in, what's the role of social entrepreneurs in helping to do that? So for this audience, how can we engage with media in a way that helps to accomplish that? Terry.
Yeah,
microphone.
This is for hi, my name is Terry, and this is for the distinguished panel. Would the Skoll World Forum be newsworthy for any of your channels, and are you covering the Skoll World Forum in all or in part?
Well, I think the work of the people at the Skoll World Forum is something we care very deeply about. Fred here is a correspondent for the NewsHour who does a lot of work with covering social entrepreneurs around the world, and that is the most exciting thing, I think, about the stories that I hear at this forum this week is that there are more and more stories to tell. We will never run out of stories to tell about people doing bold and brave and courageous things in their communities, and that is a great way to get into any story, whether it's about a medical crisis like Ebola, whether it's about an environmental crisis, et cetera. And so by finding those stories, we can illustrate those in ways that are compelling to our audiences. And for sure, ratings are a challenge for many in the media, and all of us are aware of that there's a lot of different places to get information. So we want to tell compelling stories that matter. And what I encourage all the social entrepreneurs here to do is to be thinking about how to work with journalists to help amplify your stories. And that's a big challenge, because we look not only to tell your stories, but to tell them well. And that includes a degree of trust and access, and that's a challenge that we face every day. And I understand why that trust is hard to earn.
My question is more that the overarching theme for the Skoll World Forum is about the fact that the brilliant social entrepreneurs who are here, Jeff Skoll, his vision is that we can make the world a better place, that we can make a difference. And that's a very positive, optimistic view of the world. And I'm wondering if that message, of course there are individual stories here to be told, but really the story of the Skoll World Forum. And I'm wondering if anybody's really covering that.
We may not be covering it as it is happening now, but the good thing is that there are conversations that have been going on, and some of the people attending this forum and other fora that's going around, we are in conversations with them about what we can do. There are those who have approached me to say they've got innovative ways of tackling some of the health challenges in Africa. Can we have a discussion? These are the kind of people I'm looking to give a platform to help us address some of those challenges, health challenges that are facing Africa, economic and social challenges as well. I'll be, in fact, before even coming here, just visiting your website and being able to go through your past discussions and events, and you meet people with excellent ideas you want to put out there for people to share. But the other thing that we are forgetting, which we haven't touched about in this discussion, is the power of social media and the power of citizen journalism. So for example, if you're finding an area like northeastern Nigeria where Boko Haram is wreaking havoc, a difficult area to cover and deploy, then you look at what, say, a language service such as the BBC Hausa service has done. Yes, it couldn't deploy in northeastern Nigeria. In fact, we withdrew our reporter, a lady from Maiduguri in Borno State, because of safety reasons. But we still managed to cover whatever is happening in that area because of the relationship you establish with an audience. What we media organizations need to do is to establish an affinity with the audience to a level where if something happens in their environments, they feel empowered enough to tell you. They feel they can access you. They can send you a text. They can send you a message on Facebook. And believe you me, some people have not been to northeastern Nigeria. You may think in such an arid, remote place where maybe technology has not reached. But how do we get information from Borno State, from Adamawa State, from Yobe State? Even when the government had imposed a curfew there, and even when the government had made sure that communication is so difficult, we still have had people who are going an extra mile to make sure that they're telling us, hey, BBC Hausa service, there is an attack here. There's this that's going on here. So for example, when Chibok girls were abducted, why was BBC the first to break the story? It was because of one person there who simply sent a message to a member of the BBC Hausa service and said, last night, this school was attacked and more than 250 girls are missing. Parents are in shock. Do something. And we began, and the world woke up to that because of the audience themselves. They've got the power, they're the stories. When we meet here and I take your business card, I don't look at that business card as a contact. I look at the business card as a story, and as a story of humanity. And that's why I'm in journalism, is about humanity. So when we meet here, and that question you've asked, we are establishing contacts not just for today, but also for tomorrow. So it's not all lost. Yeah.
And right after I leave this room, I'm shooting an edition of my program for next week here. So I hope you watch.
If I can just make one quick observation. There's a wonderful former war journalist and producer who passed away recently, John Seisoff, who was part of the Skoll World Forum community. And he made the observation at one point that when his broadcasts were international rather than domestic within the US, that they would see their ratings go down, unless it was a social entrepreneur story, in which case the ratings stayed the same or went up. And so there is a role for social entrepreneur stories in helping you to engage with your audience. Yeah, please. Sorry, you'll be next.
Hi, I'm Dave Beard from PRI. I was going to also answer that in addition to the stories that we get each time, we ourselves have challenges, and the social entrepreneurs here help us, both inspire us. You know, if somebody can come up with an idea using cell phones to take the waiting time to fight TB from 90 days to real time, like that, I can solve an issue, or David Bornstein can solve an issue of how do we get past people who have preconceived notions about a story. What are the techniques that we can do to sort of combat with latest research in neuroscience or something to find techniques in which people can move beyond that? So, like say in the case of an American Purvi Patel, if somebody hears the words "drop their baby in a dumpster" as the first fact, as opposed to "gonna spend 20 years in prison for a stillbirth," I don't, you know, their judgment is already formed one way or the other. How do we move beyond that? So these are the kinds of things, not only do we have solutions and stories, as Solomon mentioned, but we also have issues in getting the message across that can be solved with the aggregate of the great minds here.
Okay, if we could just jump to the gentleman in the back.
I come from a less interesting part of the world than Africa, called Palestine. And to tell you the truth, people in my country, especially after the war on Gaza, the last war, have given up on cable TV, have given up on news channels, certainly given up on Al Jazeera, certainly given up on Al Arabiya, and now they focus on social media. So never underestimate the power of youth in social media, and never underestimate the power of social media in advocating for Ebola and other diseases in the country. And I think, thanks to the internet, that people now in my part of the world are aware of the problems and the concerns of people in other parts of the world. So social media, blogging, websites, and live interaction is doing it all now.
Yeah, absolutely. Cecilia?
Going back to the questions about social entrepreneurs, I just want to give my testimony that since I was awarded in 2008, almost all of the international media go to the Philippines to cover our work. Like a BBC actually go to our areas in the southern part of the Philippines, which cover the back door of human trafficking. In that area, BBC, CNN, of course, make 2-hour documentary in our work. So what I'm saying is that the Skoll World Forum, you know, the social entrepreneurs, you provide this kind of space for social entrepreneurs that've been working so hard and struggling in the ground, you know. And I think it's good if we can really integrate it and try to institutionalize it, and focus also on other social entrepreneurs that also struggling in the ground. Definitely, I feel that it puts a spotlight on this area that had been neglected for a long time, especially like, for example, in my case, which actually how many miles away from the center of the universe when it comes to media focus. So I just want to say thank you. So it works. Can I pass this microphone because this lady has been
yes, absolutely. And
sorry.
We're coming up on the end, and I am going to ask each of our panelists to do sort of one takeaway for this audience. So if you have a burning comment you'd like to make, not a question for response, I'm happy to take any last ones of those before we go to the takeaway.
My name is Catherine Green. I'm a former colleague of Leaf's. I ran the CNN International Network. And I really understand exactly what you're saying. The one thing that I find in fear is that we've become trapped in our own little paradigms. And we, as journalists, are beginning to externalize fear and externalize selfishness because we don't necessarily understand our audience anymore. And I think our opportunity is to externalize some hope. And so when I heard you, because I so understood, Ray, what you were saying about starting a newscast, I also think we can start a newscast and say, good evening. Hundreds of people are dying. Their fathers, their mothers, their sons, their daughters. It's a contagious disease, and we can probably stop it. And I think that that externalizes a hope, and still causes people to want to watch the story. We think they won't, but I think they do. And I would say there's a tool, which we should all get our hands on, at Mashable called Velocity. And it's quite stunning when it's looked at by a journalist, because it tells Velocity which stories are going to be consumed by an American audience for how long, and at what point they will absolutely lose interest and stop sharing it, which is a big measurement now. And the Kardashian story was happening when I was in Mashable's office. And the most stunning thing was America wasn't interested in it. It was like a little headline that you could pause on for a moment and digest and have a sense of, oh, but they left it so fast, and we stayed in it. The media stayed in it. And I think if we could have tools like that that help us understand that maybe we're doing some empty calories here, we might be able then to focus more on the stories that were meaningful that day, and people were consuming at huge volumes for hours on end, by the way, that we weren't paying attention to.
Great point. Any final comments from the audience before we turn back to our panelists?
Add to that a little bit. Hi, I'm Molly Bingham. I kind of want to tie, I think, what Bassem was saying together with what Catherine is saying, that I see journalism, I think, stuck in an outmoded way of thinking about or seeing the world, not because we're evil, but I think because of the trajectory of evolution of where we've come from, and that we still frame our stories profoundly in an us-them structure, right, where it is about somewhere else. And I think that as a human community, people are recognizing that interconnectedness and feeling it more readily every day, and that if we can upgrade our own perspective to reflect and tell that story of interconnectedness, that it is about us, right? It's not about them, it's about us and families and people that are connected to us, even if they're geographically distant, that can make us feel more current, feel more present, feel more real, and frankly be more meaningful, I think, to a much wider audience. And Bassem's that the hypocrisy, right, of a lot of media coverage where we demand elections for the Palestinians, but we don't like who they elect when they do, but we don't demand it in Saudi Arabia, right? I mean, it's a really interesting and very, I think, present hypocrisy that the world sees, and it invalidates a lot of work that we do that's great.
Thank you. So with that, I would like to ask each of our panelists, maybe we'll just go straight down the line here, for sort of one or two key takeaways that they hope this audience will take from this conversation on this topic.
Well, jumping off what you said, Catherine, when I look back at the last 22 years, where during that time I've worked for NPR, the PBS NewsHour, and now Al Jazeera, other places would actually have me, but the thing that makes those places have in common, and the reason I'm happy to work at them, is that at a time when broadcasters are more and more afraid of their audience, they live in fear of the audience, that any second, if we don't constantly stimulate and entertain them, they're going to turn us off. Oh my God, they're going to turn us off. If we spend 15 seconds talking about this instead of that, they're going to turn us off. These places that I've had the pride and privilege of working for, we have confidence in our audience that if we do our job well, that we can be engaging, that we can be entertaining, that we can be informative, and we can be smart, and we don't have to be afraid that they're going to turn us off. And so it's why after all this time, it's not just that I have another kid that I have to send to college. It's that I really still love this because there are people who want what we do still, and that's what gets me out of bed in the morning. Okay.
I think that, Molly, you raised some interesting points. I think for us at NPR, this notion of people over there, I always sort of caution people when I talk to them about our coverage over there. It's like, over there, our coverage of places other than the place we live is, let's not do this sort of specimen jar kind of, oh, look at this interesting thing that we'll now investigate. It's why we've invested so heavily in having bureaus around the world, and in fact, our expansion into international news coincides with NPR's expanding audience. And what we, our sort of informal tagline for ourselves is, we take you there. And I think that human connection is exactly what is the differentiation for us. I was talking to someone yesterday about, there's a lot of horrible news in the world, and yes, there is this temptation for people to just say, oh, I can't deal with it, it's horrible, I don't know anything about what's going on there, I'm turning off. But if you can find a person that they can connect with, when the school was attacked in Pakistan by the Taliban, okay, could there be any more horrendous story? What can you do about that? Sitting at your home somewhere in America, probably not a lot, but can you feel something about it? A week later, our reporter went back with one of the teachers, just her first time back, walking through the school, talking about the kids who had died, about the kids who were going to come back, and she had to be there for them. And as a parent, I was like, wow, I wish and would hope that my kids could have teachers like that. So I think that, we're still fighting the good fight, and we're living in a smaller world, and I think people really want to know about it.
1 minute each, please.
Yeah, it's the choices we make, and those choices are seen through the faces and voices we give the platform to. If we limit those choices to just a few people, then we are not doing our profession any justice. It's about opening those platforms to people from all walks of life, because whatever incident it is we are covering, if it affects one person, it definitely has resonance with another because of the one thing that I said with humanity. If it is a tragedy happening in Pakistan, as we saw that school that was attacked by Taliban, now look at what happened in Kenya at Garissa University College. Those two stories, they draw parallels. If it is about terrorism attack on the Twin Towers in America in 2011, look at what happened in East Africa in 1998. So you find there's so much we can draw parallels upon. There's so much that bring people together than separate people. The other thing is, for example, in terms of social entrepreneurship, and why I feel that you shouldn't go away with this notion that the media is not paying attention to this. No, not at all. Because we've launched something called Africa Partnership Initiative, which makes the BBC in Africa work closely with broadcasters in Africa, local broadcasters in Africa, because they are local to their own audiences, to their own issues, and we want to share that. So you find an entrepreneur in Ghana, who now people in Ghana can go and buy medicine without the fear of buying counterfeit or fake drugs, because of that mobile app this gentleman has discovered, which can tell if tablets or if the medication you've bought is genuine or not. And when this was done on the streets of Accra, you could never tell, somebody could never tell the difference between this cup and this cup. You're sold this, you buy it, it's fake. You'll be lucky if you bought this because it's genuine. That app will now be able to help anybody in Ghana and other parts of Africa. When you go to the counter and buy your medication, you simply point that, the tag, the serial number, point it to your mobile phone, it will tell you it is genuine or it is fake. And that is saving life. My last point is about competition and collaboration. Sometimes we make a mistake that Al Jazeera is in competition with the BBC, CNN is in competition with this and that. But what Ebola taught us is sometimes the best way to compete is to collaborate. So what we did was to collaborate with Voice of America to share content they were getting from parts of those countries that were affected by Ebola that we couldn't. And we were giving them material which they could not get. And in so doing, I think we were contributing to this greater cause that is humanity.
Great, thank you. Sarah?
I want to do a story about that app. But I just want to say what the Palestinian gentleman was said earlier resonated with me very much, is that we in the media have to not just tell good stories and tell them well, we have to put them in the places where people are looking as carefully and strategically as possible, because that is changing all the time, and that is as much our challenge as the storytelling piece of it. And it's true for social entrepreneurs as well, working with us. And That's a big takeaway.
Wonderful. Well, I hope that coming out of the forum, you will create all kinds of new partnerships, get new ideas, and we can advance a lot of the great ideas that were brought forward in this session. Please join me in thanking my panel.